Hi, good evening, everybody. Welcome to another very interesting episode on Dogspot Facebook Live series. My name is Anand. I'm a founder of a company called Anvis Inc. and Alpha by Anvis. We are a pet services company. We also are into pet learning. Uh, hey, hi, Rana. How's it going? Uh, so we're just waiting, a few more guys to join in. So today we do have, it is an interesting topic, but perhaps it's also not a very fun topic to talk about. But I think all the more, I think it is an important topic that I think most of us need to be kind of aware of. Hi, Ashima. Um, So today we are talking about 10 warning signs of cancer in dogs. Um, so just waiting to see if if more of us are going to join into the session. Hi Subramanya, good evening. Right. So as I was saying, right, my name is Anand. I'm a founder of a company called Anvis Inc. and Alpha by Anvis. We are into pet services, and then we are also into pet learning courses, e-courses, rather consultations, e-courses. That's what we do. Today is yes. Ashima is saying it's a very important topic. Yes, absolutely, Ashima. I think. Dogspot did come up with this topic, and I'm here to share mostly my personal experiences about how I have dealt personally with this dreaded C with my own dogs. Uh, Hi Joel, hi Darshita, hi Chris. And like I was saying, for the guys who joined in now. So this is again right in a series of Dogspot. So many educational stuff. So many people have come in and spoken such on such interesting topics. This signs of warning signs of cancer in dogs. I think this is. I mean, it's a little bit of a not a very nice topic, but I think it still has to be done, has to be said. And I'm here to share my experiences because I have been unfortunately, I ended up loving this one particular breed of dog for the last 15 years, the boxer, and yeah, they are predisposed to cancer. So I have had so many personal experiences. Unfortunately, I have lost a few of them to cancer. So I thought maybe I will share some of the signs that I have personally gone through, and maybe it would be helpful to someone. Hi Mira, good to have you here. Hi El Matini, hi from Australia. Hey, welcome. Hi Darshita. Okay, so I think I'm going to start off. So, what are the early warning signs that we are looking at when it comes to uh, cancer in dogs? I think there are a few things, and I think I've tried to keep it as from a personalized standpoint. I need to give this disclaimer here, guys. I'm not a veterinary doctor. I'm not trained, and I will not be able to address any questions, concerns when it comes to the medical aspect of things. This is purely, like I said, from the viewpoint that I have I have been owned by this beautiful breed called Boxer, unfortunately, which is predisposed, by cancer, and and hence, I thought maybe I should share my personal experiences. It perhaps may help somebody here. Uh, Anjali says, I lost my dog last week. Oh, I'm so sorry, Anjali. It's yeah, it's a very it's a very unfortunate thing. rest in peace. Rana is asking, why is the topic personal to you? Rana, I will explain, right? I think like I said, I have been owned by this breed boxer, and unfortunately, uh, some dogs are predisposed. But I'm just going to talk about it. And on that same note, I think we will just jump into it. I think genetics, right? So first thing when you talk about cancer is that most dogs are predisposed to certain kind of health issues. I would say almost all. It's just that you need to know which dog is predisposed to what, and you may still end up having that. But it's very, very important to know which dogs are predisposed. Since we're talking about cancer today here, I would like to share with you guys that there are certain breeds that are predisposed, right? Genetically, that cancer is there in that, and with breeding and so on and so forth, it just continues to go from generation to generation. Some of the breeds that are predisposed are, of course, boxers is one of them, which I have I have been loved and owned by. Golden retrievers are is a breed that is predisposed to cancer. Rottweilers are predisposed, Great Danes are predisposed, Labradors are predisposed, German Shepherds are predisposed. Right. So when I say predisposed, it doesn't mean that the rest of the breeds do not get this or may not get this. They will, but these breeds of dogs have a very high chance of getting this. So if someone is going for any of these breeds and you want to adopt, bring home any of these breeds, I think it's very important as much as possible to do some research on the parentage and try and understand if the parents or and that's where the whole KCI certificate comes in, right? The KCI certificate is just not a piece of paper that just says, okay, this is the pedigree. And so it's very important to dig down deeper into that and then find out what were the health issues that were there. As a breed, we know that there are certain health issues that each breed is it's already there, and it will carry on from generation to generation. So it's important to have a very frank talk with whoever the person is, saying that, hey, how did parents or the grandparents or whatever, when they passed on, how did they pass on, right? Was it through this particular thing? Was it to something else? Like, for example, there are breeds that have other predisposed, just not one, right? So, like, say, boxer is also predisposed to something called cardiomyopathy, which is your heart problems. Labs and Goldens are predisposed to hip dysplasia, elbow dysplasia, things like that. So it's very important to have a frank discussion to say, hey, what am I getting into? You need to be mentally prepared into this. Because, see, we are going in with our eyes open into this breed. We love a particular breed. We want to go in with that particular breed, but we also need to understand that along with all the nice characteristics that come with the particular breed, there are also these other set of health issues which is very, very difficult for us to sort of overlook. It is there, right? It's a package. So we need to sort of own up to that, and we need to be prepared for that. The more mentally prepared we are when we know that, hey, this particular breed is predisposed to certain things, I think the way we bring up the dog is a little different. The way we the care that we take is going to be a little bit more different, right? So yeah, so Kritika, do genetics play an important role? If yes, do you check on your dog knowing anything? How do you check on your dog not knowing anything about his or her parents' history? How do I know about the history if I know nothing about the parents' health? Yeah. So I think, Kritika, see, because I know a lot of us have adopted dogs in different scenarios, and we will not have an idea how the parents were and did they have this and how did they pass on, etc., etc. Right? So this is one starting point, right? Genetics is a starting point. If we don't know, then there are other things, right? So when we say a breed, right? Let's say if you've adopted a boxer or a German Shepherd or a Golden Retriever, I think somewhere along the line, you already kind of start looking to say that, okay, I probably think that, this is predisposed in this particular breed. And these are the things that I need to watch out for. What are the things I need to watch out for? What are the things that you need to watch out for? I will share with you as we go along here some of the things that we need to do every single day, especially when we know that these certain breeds have got a high risk of having this in their genes. All right. So L says my English stuffies are also purebred and have genetics for mast cell tumors. I have my 5-year-old boy, have 3 cut out already. Yeah. So LB will also talk about that. Yes, of course. Right. Um, so the first thing is knowing the breed, right? So understand about the breed, understand which breed comes in with what kind of predisposed health issues are there. If it is, then talk to the, if it is a breeder, talk to the breeder. If it is an adoption agency, talk to the adoption agency. Perhaps they may know where is the source, so on and so forth. If none of that is available, then of course we move on to. But I just want to quickly, now that Elle is talking about mast cell tumors, or what we call as MCT, right? I just want to quickly give you like a layman's interpretation of what are the types of cancers that are there, and like in a very layman. Again, like I said, I'm not a veterinary doctor, guys, so I'm not going to give you from a medical standpoint, but just from understanding perspective, right? So one of that is called one of the cancer that is which affects the skin, lungs, nose, mouth, right? So what Earl is talking about, right? The mast cell tumors, or the MCT. That is one particular type of cancer, and then we have the melanoma, which is basically related to the skin. The second type is basically which attacks the lymph nodes, lymphoma. This is basically the blood cells and the lymphocytes, right? So that is the second side. A third is which attacks the bones. So it's called osteosarcoma, and this is more to do with larger size dogs, like say maybe Great Danes, right? So they are prone to osteosarcoma because of the bone size, etc. And the last one, there are multiple things, but these are, in my opinion, these are my top things that I've seen that have come up so often when we are checking for cancers, right? The last one, which affects the heart and the spleen, which is called hemangiosarcoma, right? So these are the ones. Again, I will not go into detail about that, because I think for us it is more to do with what does it affect, how can we try and identify what are the symptoms that are being shown by the dog? How can we identify? What can we do to correct it if there is anything that we can do? Right. So Kritika has a question. I have a 7-month-old American bully. Is it something that I should? Yeah, is it something that I should worry about? Uh, Kritika, I'm going to give, like I said, because I have been owned by boxers for the last 15 years. I've had some amount of experience in trying to pick up on some signs, so which could perhaps lead to these. So I'm going to sort of run through that, and then see if any of these are applied. American Bully, I don't think they fall under the high risk category, but you may want to match the symptoms and then see, and then of course your vet is the person to go with. Vijaya says I have oh, sorry, that's okay. Vijaya says genetics is the most of popular breeds have gone for a toss due to backyard breeder. Are there any available tests to diagnose cancer stages? Vijaya, so let me share some thoughts, right? So again, I think it is more to do with what are the health checks that we can do to identify what is it, and then what can the based on what is a vet recommendation suggestion, how do we take it from there? We'll touch upon that in just a bit, right? So genetics, of course, right? So that is one thing. Which breeds are more predisposed? What are the types of cancers? Right, typically affects skin, lungs, nose, mouth, right? Blood cells, bone, heart, and spleen. I think these are the main things that get affected. There are multiple more, but these are really the main things. So second is, I think, in my opinion, what plays a bigger role is, I feel, diet and nutrition. Right? It's a controversial topic, but again, I will go back to my experience. Right? So currently, we tend to give, like, a lot of us are on kibble. I was also on kibble. I was also feeding kibble for my dogs. And then we had multiple brands. We used to switch between, so on and so forth. Um, However, I think at some point when you start correlating these two, which is if you have a breed that is predisposed to this, and then you're saying that, hey, can diet and nutrition, does it have an impact? Can it add on to this? I think there are a lot of studies that do show some sort of a correlation between this, right? So diet and nutrition has got some kind of a correlation between this and cancer. So in my opinion, I think, right, so processed foods is not really the best, at least if you have a breed that is predisposed or you sort of notice signs, symptoms, etc., etc., purely because of the preservatives. Now preservatives, it's bad even for us, and that was we have been told. We still somehow consume them, but when it comes to our dogs, and because we have to make the decisions for them, I think it's very important to kind of make sure we try and stay away from that as much as possible. I'm not saying everybody has to shift away from that, but I'm saying you may want to make a better decision, which is, there is always, if you're giving kibble, and kibble is the most, I mean, it's the best diet that you feel in terms of convenience, in terms of other things, by all means, but at least make sure that the brand is good, right? Understand who are the people behind this. Do they understand? I mean, how is this? Where is this kibble coming from? Are there quality checks being done? So on and so forth, right? Because kibbles get manufactured by so many companies, and many times there's no quality check, and then there are just fillers added, which just aggravates, if a dog or a puppy is predisposed to this, and we don't want to sort of be doing this, right? So do your research. I will say do your research. Find out if kibble is what it works. Find the best kind of kibble. Find what works for you the best before you can jump into that. You don't need to like actually change. But I made a change for my own dogs. I moved them away from kibble because of the previous experiences that I had. I had actually lost two of my girls, uh, to cancer, and then the last one, I changed the diet because I said maybe something was not okay, and then I moved her to a different kind of a diet, which is non-kibble based, and which is more meat based diet, and so on and so forth. I definitely saw a marked improvement in the way everything was working on, the digestion, her coat, skin, etc., etc. So it worked for me. I mean, I'm not saying it will work for everyone, but I'm thinking with diet definitely does play, right? And I feel fresh food is better. Just in my personal honest opinion, I have seen that working really well. I will say if it is possible, you can. I will also suggest that you probably need to go in with a slightly higher protein diet. Maybe talk to a canine nutritionist, find out what works best for your particular breed, and and they will be able to suggest. And or if the dog has been diagnosed, then I think you definitely have to take a serious view on nutrition, and then you need to change the diet. Because if you go on the internet, and then if you try and Google protein, sorry, diet and cancer, right? If you put that, or carbohydrates and cancer, you will see a lot of back and forth, which says that how carbs are so bad, and that will just accelerate cancer in dogs, so on and so forth. But there is also a study that says that you do need some amount of carbs, and they can digest that amount of carbs. So there are two schools of thoughts, right? So personally, I have very little. I mean, for my dogs, very little carbs or no carbs at all, but on a more protein based diet, right? But to each his own. I think you have to speak to your vet. You need to speak to your nutritionist, especially if a puppy or a dog has been diagnosed with cancer. What needs to be done, what kind of diet needs to be given. I think you need to look at that. uh, and I think we have a question here. Subramania says, none of my dogs had health issues, fortunately, but for the audience, please let me know average age of cancer development and influence of food and exercise. Absolutely. So I think, Subramania, most of the dogs, at least in our my experiences, they start to show signs at about 6 years or so. And then, and then going on from there. So 6 to 9 is a slow development period, and 9 or 10 onwards, it really picks up. And when it is in that advanced stage, I think it is, unfortunately, it's fairly downhill, right? I think at that time, the only thing that one needs to keep in mind is quality of life. What's the best quality of life can I give when things are going really bad, right? But mostly at about 6 onwards, right? At 6 onwards, it will, if there are anything that is there, any signs that we can see, and I'm just going to touch upon some of the things that we could perhaps look at. But 6 onwards till about 9, from 9 onwards, it really deteriorates. Vijaya is asking, what's your opinion on putting dogs on a vegetarian diet? I think, Vijaya, I'm not a big fan of vegetarian diet. I'm a vegetarian. My dogs are not vegetarian. I'm not a big fan of putting my dogs on vegetarian diet. You have to have a species appropriate diet. High protein is definitely required. So yeah, my dogs are all on high protein, if not even high protein, but protein diet, protein based diet. Uh, right. Uh, so yeah. So, so next, right? So diet, right? I think diet is something that we need to look at. Look at. You have to make a choice between kibble. If you want to do fresh food, if you want to do fresh food, my suggestion is actually talk to a nutritionist. If you want to do kibble, do some research, right? And find out which works well. Don't just go, because there are so many brands of dry food, and more preservatives that are there, the more it's going to cause discomfort to your puppy. So do some research and find out what is a kibble. If you can do fresh food, do fresh food. Consult a nutritionist. I think that's the best, because things are changing drastically in the dog's body. So you need to make sure that you compensate for all that. Right. So I think here is where I think we need to move to what are really. So what did I do, right? I think this is just my personal thing. What did I started doing once I realized that? See, once you realize that your dog has got or has been predisposed, and you start doing that, this is something that I follow religiously. Hands-on examination at home every single day. Right, you cannot miss a single day, because if you have to catch it in the early stages, this is the mantra. Right. So what are you looking for when you are examining your dog? And I don't mean that you have to put your dog on an examination table and then you need to, like every day, right? Maybe you're brushing your dog, you're spending, as you're spending time, and we all, as dog lovers, we all tend to do that, right? You're doing something, your dog comes to you, your hand automatically starts going in, and then you're searching for ticks and fleas, right? I'm sure every one of us here who have had dogs have done this, right? Without knowing, our hand is going and searching for ticks and fleas. So you know that there is something there. You quickly find that, oh, there's a lump, and that is exactly what I'm saying, right? So a lump or a mass that you see which is abnormal, which has come up, is something that you want to really investigate. That is your first sign that something may be. I'm not saying that that is the sign, but I'm saying that that is one of your early warning signs, saying that, hey, there is something that we probably need to give it some due consideration. So what has been told is, if it is the size of a pea, right, the pea, the vegetable, and it remains like that for a month, definitely get it checked by a vet. Do not allow it to go beyond that. However, at the same time, there is an experience that I want to share with you guys. I had someone calling me the other day. I mean, not now, but some time back, and this lady was obviously freaking out, and she said, I saw a lump on my dog, and it's a very small lump, but the lump is there, and I think it is cancer. So I tried to calm her down, and I said, okay, can you walk me through what happened, right? Did you see this just today? Was it there like a few days back? What's happening? So she said, no, 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 everything was all right. Nothing was there. Yesterday, the doctor came, gave an injection. Today, I'm seeing that there's a lump there. Then I said, okay, hold on, back this truck. What happened? The doctor gave an injection. Doctor gave an injection. So when doctor gives a vaccination, many times what happens is there's a small lump there, right? So So you would have seen it, and that goes away in like a few days time. um, so then when we spoke, we obviously we realized that it was just that in 2 days it disappeared, and anyway she had a word with a vet and so on and so forth. But what I'm saying is, don't freak out every time you see that there is a small little lump on. Understand what is there, right? What was the background? Did something happen? Any change in environment? Anything is there? It could be an insect bite. It could be some other bite, right? So don't freak out because it's a big C. And I think we do tend to do that, right? Because it's playing in our minds, and then we know that, oh my God, my dog is predisposed to this, so I should be on the watch out. Yes, you should be on the watch out, but also use common sense, right? That's what I'm saying. Try and understand what is there, what happened before we jump to the conclusion that this is it. And that is just not the only one. But of course, if mass is there and there is a growth anywhere and it is growing, needs investigation ASAP, right? You cannot delay a growth that is growing, and maybe at a slightly faster pace. And I also see that. So I think there's vegan, but yes, my dogs are on eggs and chicken diet. Though I think my fecal seems to have upset and few allergies, hence trying to. Okay. L says, I highly support what you're saying, but the size of the pee, get it checked after a month and take photos weekly. I did, and it was mast cell cancer. So I think I'm just going to put this up. I think this is what it is, L. So L said that he did get it checked after a month and take photos weekly. So maintain some kind of a journal or some kind of an entry saying that how big is it growing, does it remain the same, whatever, because your vet is going to ask you this: when did you first see this, how has it been growing, at what pace has it been growing, is it really big, small, whatever it is. So have enough information, and then the vet will take on, right? I will not get into what the vets will do, but I will leave it at that, right? So always check your pets every single day, especially if they have touched 6 5 6 years. Every single day, please make it a habit to check and see if there is anything. Second, again, these are I think this checklist is more to do from my experience and that I've known my own puppies that have gone to different homes, so on and so forth, or for friends, family, whoever, right? Yeah, so that's what it is, right? There could be many more symptoms, but these I feel are my top. So the second one is there will be a slight swelling of the abdomen. And I think it makes logically it makes sense, right? So if there is any growth internally, what happens? The growth will grow and it will start pushing everything outwards, right? So you will see that there will be a slight swelling. So again, you may want to check that out. Don't freak out again. It could be something very simple, but if you see that there's growth, if you see that there is swelling in the abdomen, your spidey senses should start tingling, and you should be like, okay, what's happening? Especially slightly older age dogs, right? Um, right. Then we have, I think a very classical symptom is chronic weight loss and lethargy. So dog will become a lot more lethargic. Appetite will be iffy, but you will see that there is going to be a chronic weight loss, and they will lose weight pretty quickly. There will be times that they will have their meals and nothing else has changed. What I mean is the exercise remains the same, food quantity remains the same, but they are losing weight along with maybe slightly. The abdomen has been maybe swelled, or there's some mass that is there that is hanging around, which needs to get checked, so on and so forth. But chronic weight loss, lethargy can be symptoms of many other things. Again, so do not connect just one single one and say, okay, this is it. But every day you kind of see. But if you see that there is a weight loss and drastic weight loss, then immediate, right? I think you need to you need to go. Lethargy is of course, right, one of the other things. Another symptom that I have seen is that they will have a lot of difficulty, toileting. So mostly peeing, pooping. Sometimes there'll be blood in the pee. again, right, I think if you start connecting it, these cells are growing inside, right? Maybe they've attached to the spleen, they've attached, somewhere, something is going on inside the dog body. So when all this gets pushed, um, so it's like a blockage somewhere, and hence you'll see that when they're trying to toilet, so they will find it difficult, they are struggling. We could think, hey, it is constipation. Again, like I said, right, these are not standout symptoms. It could be related to other things, but watch out. Again, it goes back to the genes, it goes back to genetics. If you think that there is a breed, you are owned by a breed that is predisposed, then you may want to keep looking at this, right? And one of the other things that I have noticed is, again, right, it makes sense, is that they will struggle to eat or swallow. um, Now you will know, you again, right, it makes sense. So if there is a lump somewhere, if there's growth internal, right, it's obstructing them to swallow, eat, digest, so on and so forth, or there's some sort of a pain, then it becomes difficult, right? You will see that they're struggling a little bit. Again, these are things that you have to like watch really carefully. I mean, you should be looking to see, what's happening. Is this a regular thing? Is it a one-off occurrence? What is happening, right? These are things that you need to keep a very, very close eye, and this is a daily thing. These are things that you want to watch out daily, because every single day, trust me, guys, if you've been through this, that every single day that you miss out, is, or you catch it early, is that much better, right? And you only appreciate the value of those every single day, every single hour, at a much later point in time. So make sure that you catch these smaller symptoms. Anything you feel is a little amiss, I think it's just best to go to a vet and get this checked out. I think Amrita has got something. My dog had got cancer. Let me just put this up. My dog had cancer and her leg got amputated in China. As of now, she's cancer free, but as a precaution for reoccurrence, what should I feed her on a daily basis? More protein, chicken, and what else? Is rice recommended, or should I completely stop? Amrita, I think a nutritionist should be able to take this up. I probably may not be able to answer this, but yeah, whether you want to mix rice with this on a daily basis, proteins is definitely recommended, because rice has got starch, and that, it adds to multiple things. So I would suggest just have a quick chat with the canine nutritionist, find out, right? Because again, we want to know what is the kind of cancer that is there. Was it a skin cancer? Was it a heart? Whether it was related to bone? What was that? Based on that, I think they will be able to probably recommend this a little better for you. So Elle makes another point over here. Also, with spots, they don't necessarily grow and they can still be cancer. It's more about if they don't go away after a month. Absolutely, right. So most of these, the tumor, right, when they start off, I think they're a very small size. Sometimes they remain like that for a very long time, because they are in the kind of in a dormant stage, because they're feeding off inside, so on and so forth. But for a month, if it remains, then there's something amiss. Obviously, you need to go. But at some point, they will just take off, right? So they will really grow. And I can share a personal experience. One of my dogs, she had this, and she had this huge lump on her thigh. Actually, started off with a very small one. We got it checked; it was not growing, and we said, okay, let's just leave it as it is. We kept checking; everything else was all right. We kept going with it, and so slowly the lump was growing, right? So the choice was to either get it operated. We could have got it operated, or we just let it be, right? From an outside perspective, the having this lump on the leg was, I think, just bothering her, bothering me. But there's also this thing. Again, I don't know if it is something. This is not a. It's not a medically, uh, validated one, but there are a lot of theories that suggest that once you remove that lump, right, you operate it and you remove it, depending on the kind of cancer, what happens, it's called a mother something. So once you cut it off, what happens? It starts going back in the opposite direction, and then it starts growing, latches onto something, and starts growing itself. So again, you may want to, again, it may be different for different people, but you want to have a detailed chat with your vet before you go in and remove the MCT, if it is MCT. In my case, that's what happened. As long as the mass was there on the outside, and and all that, it was bothering us, but it was still all right. We got it operated, and once we got it operated, then it just went in, and then things went really bad from there. And it unfortunately, it happens really quickly. It doesn't give you time to sort of react. uh, yeah, uh, so I think Mitali says, please highlight a few human edible food items which are cancerous that unknowingly people may giving dogs. Any specific human medicines that shouldn't be consumed by dogs at all? Um, Mitali, so see, for me, I think I mean, normal things, right? Whether it's connected to this, what we're talking about, or something else, right? It's the same, right? So you don't give them spices, you don't give them any kind of food scraps off the table. Our food is not their food, right? They have a different set of food. Theirs is more of a protein based diet, that kind of a thing, right? Medicines. I don't self medicate. I have been with dogs for, I don't know, as long as I can remember, right? 40 years, maybe 35, 40 years. I do not medicate my dogs at all. But even if I know that a certain medication will work for certain thing, I will always check with the vet and say, hey, is it okay? Or, I'll take my pet, and then only after doctor says okay to go ahead with it, I will. Except for small things like maybe deworming and stuff like that, I do not medicate. So not even the medicines that are prescribed for dogs itself, human medications is totally out of the question. So I will not recommend that, because there could be a lot of reactions, because there could be something that is happening internally which we have not checked, we have not seen, and then that can lead to something else. So definitely not human medication, definitely not. Even the normal medication, I wouldn't really recommend if you don't know, or if you're not a medical practitioner. Um right. Okay. So so moving on, right? Oh wait, I have a question here from Subramanya. So Subramanya says, how much is a myth that if a dog is not spayed or neutered, they develop cancer? Subramanya, I'm not sure if this is actually a myth or it's a fact, right? Because um, there are certain cancers that can develop, and there are studies to prove that there are certain cancers that can develop if a dog is not spayed or neutered, right? Um so so it is, right. So and especially if there is a dog that is predisposed to like the breeds that I was talking about, that are predisposed to certain these genetic traits, then it just adds to that. Again, if a vet is recommending that we we get them spayed, and I think that's what it is, right? The more we are going towards the phase of getting dogs spayed and neutered, I think these should reduce. But there are other things, right? Environmental factors, genetic things that we cannot control. So there is. I mean, if you take it holistically, I think we may not get too much perfect information. But if you take it individually and see, does it have an impact? I personally believe so. Again, I've had personal experiences. I think all the vets that I've spoken to are always almost say that spaying neutering actually has a positive effect, irrespective of cancer, but otherwise also. Right. So okay. So I think now that other thing that we want to go with, now that we're talking so much about health, right? So what are the health checks that we can do? And this is something that I want to share, and I think this is something that I learned over my my journey with with the big C, is that I would always think that, hey, we can do a blood work, and blood work will actually show up if a dog has got, anything to do with cancer. Actually, that's not true, because there are many times that cancer is not picked up when you do blood work. It is obviously recommended that you do any dog beyond, say, 6 or 7, right? I think it's just routine that you need to do blood work every 6 months, just to see what the vital parameters are, what's happening within the system, etc., etc. But will the blood work pick up? Not in all the cases, right? Certain, maybe say the lymphoma, lymphoma, I think they pick up because it's related to the blood cells, so you will see some variations over there. But the rest of it may or may not, and it's happened to me. So you have to run X-rays, maybe ultrasound, MRI scanning. Even the vets will suggest that before they can actually pinpoint and say, hey, there is something. So just doing a blood work, and if all the blood work comes in, because this is something that comes up very often. People are saying, hey, I've done the blood work and I've been doing blood work religiously for the last whatever, right? 2 3 years, and suddenly the time you do some X-ray or an MRI or something, you realize that, oh, there is something happening, because it's a lump, right? And it perhaps will not show up in the blood work, but so you need to put the dog under before this can be figured out. So this is something, right? And I kind of learned this quite late, unfortunately, with all the information available. But I hope you guys will not make the same mistake. So blood work is not the only one. X-ray, MRI, ultrasound, you have to do that, right? Regular checks, obviously, right? I think every 6 months, if you, as in how you start looking at, once, after about 6 years or so, uh, any dog, right? Not just dogs that are predisposed, but any dog, just make sure that you go in for your regular checkup, blood check, where you may want to bring this discussion up. I know it can be kind of, uh, very unsettling to have this discussion with the vet when everything is doing all right. So, but it's always good to have the vet let them know, hey, listen, I'm just thinking, is there anything that else that we can do in the blood work? Is there something else that you could suspect? Is there something that you can look out, any warning signs that you perhaps picking up, so on and so forth? Just a reminder, that for them to also kind of look at it. But definitely, I think you may want to do these regular checks. And wherever they have the lumps, so obviously the vets will remove the lumps. They will send them for, they'll send them for biopsy, and then they'll let us know, right, what is happening, whether they're cancerous or not. That is really, really important. Right, so that gives us an indication of, um, what is going wrong, right? And I think some of the places that you will see these lumps really will be, if you're when you're checking the places that you need to, is, I think in my experience, again, right here, just near the eyelid, it'll be a small one, and then it will start growing, and sometimes it'll become big, that vision is this, and the dog cannot see properly, the eyelid will be half closed. So that is one. Inside the mouth, right? And you will see, especially with breeds like boxer, you will see that there will be, and you need to look at both sides, right? So sometimes you will see that near the gums there will be kind of these lumps. So you may want not get confused with that. Look at the other side, and if it's even, it's all right. But if it's not even, you know for sure that, okay, something is not okay, right? So, and any of these, of course, the doctor will say that, hey, we need to probably need to do a surgery, remove it, and then you do a biopsy, you figure it out, so on and so forth. So surgery is an option for sure, right? But the only thing I would say is, talk to your vet, have a long chat with your vet to find out pros and cons, of the surgery at what point, because the earlier you pick it up, I think it's just, and with anything, right, for that matter, any um problems that you see, earlier you pick it up, I think it is so much more better, because that gives us so much more time to sort of fight this out. um, so yeah, so biopsy is there, and then the vet will probably recommend. I know of, although I'm being so negative about this, but I know a lot of dogs that have fought this, and are doing absolutely well and are thriving. right? So it's not all. It's not that all is lost. So have a chat with your vet, right? Like I said, it could be something really small and it's really not kicked in yet, and you catch it early, you remove it, you get rid of it, and then you watch, you keep doing this. I think in many cases, I think it really helps. Right. So Vitali says, when should be the first blood work done for pups? No suspicion. Is it needed before a year age? Mitali, no. So mostly, if you're looking at this particular, if you're looking to see about cancer, then I think it doesn't come in. I think one-off cases I've seen, but it doesn't really come up that early. But keep watching out, right? When you do your daily hands-on examination, just keep going on. You don't really need to get really perturbed and stressed about it. Usually, younger puppies, this does not occur, does not show up as the dog ages, is when it shows up. But no harm in being extra cautious. That's what I always say, right? Keep an eye out. Just know, this is basically to know that, hey, listen, I'm looking at something over here which is abnormal. It seems like a lump, and I see this lump has been hanging around here for the last week, 10 days, and it's not gone. Then I think you need to act on it and say, hey, not okay, so let's go. Then your vet will probably suggest, right, the blood work, and then if he suspects anything else, and he will you'll put the dog under and he'll do the x-ray, so on and so forth, right? uh, so just one last thing I wanted to do, and I think this is slightly I think um, it's not a very nice thing to be talking about, but having been through this, like with a few of my own dogs, right? I think the toughest thing, and I'm talking about, you've tried everything, and the quality of life, right? I think at some point we have to make, as pet parents, we have to make a decision between quality of life of that particular dog versus what I want as a pet parent. Do I want to keep my dog, allow him or her to suffer, or should I just give them a good quality of life? Unfortunately, with cancer, I think that's something that most vets will tell you, is that at some point in time you will have to make that. And I'm saying this is advanced stages, right? Because the dog is in quite a bit of pain, right? Maybe you've tried the surgery, so on and so forth. And I'm saying slightly older dog. Just a request, guys. I think, and because I've seen a lot of people. I mean, I can understand the emotional connect, and I must personally have to do that. And it's the worst thing that anyone can perhaps be. I think we can make any kind of decision, but making a decision like this is just a horrible thing. But I think at that point is to keep quality of life of that dog, and saying, hey, is this the right thing to do at this point in time? Right. Um, just one, I think that's just a parting thought. Just remember that, because we don't want them to be in pain, and cancer can, I mean, it's a dreadful thing, right? It's a dreadful disease. It's horrible. uh, right. So okay, right. So I think that's all I wanted to share with you guys. I hope you guys found some of this information. Like I said, it's just my personal information. I'm not a vet. This is not from a medical standpoint. Unfortunately, I ended up loving a breed that came in with this, and I had to accept it with what they are for. Right, they gave me a lot of love, right, unconditional one, much more than I could ask for. But they do come with these things. Right? I mean, if any of you are going through this, I think this is just a personal thing. If any of you are going through this, or your dog is being diagnosed with cancer, or you need to talk to someone as a pet parent, right? Like, as a pet parent to pet parent, not as a professional and an expert. But if you want, feel free to call me, right? Or you can connect with me on Facebook, Insta, on my this one. um, I can be. I mean, I can just lend you a year, right? All right, guys. So thank you so much for listening to me. Thank Thank you so much. I hope all of you are safe. I hope your pets are safe. I hope none of our pets get ever affected by this dreaded damn sea. But if it does, I think at least we will try and keep it preventive rather than going to do damage control. Right? Okay, all right, guys. Thank you so much, all of you. Have a good evening. God bless.